and the older. We want to be, we're a nurturing environment. We're the first step that we hope somebody comes to, and we can provide the best services for them and work with law enforcement to also enlighten them, to let them know, how to work with these cases. We have a great relationship with the sheriff, and need be, if we need any help, they're right there for us.
So Doreen, if somebody needs help,
they can call 845-225-2700, and our intake line is extension 102, but I believe at the end of the show you will have all of our contact information. They could call any of us, Deb, Jason, or I. They can go on our website and get information, or they can walk into our facility at 1808 Route 6, and we're happy to answer any questions, and they'll be attended to immediately.
Someone comes into the office. Go through the procedure for me.
Someone may come into the office and they would...
Now, are they bouncing off the walls?
Someone could be. Someone could be. Some people sometimes come in and they may be under the influence, or they may be having very bad anxiety or depression. We have staff members on crisis call throughout the day from 8:30 to 8:30 on the times that we're open.
Are you afraid about your own safety?
Not at all.
Okay.
No. We have mechanisms in place where we're all there to support each other, and we also have the local police and sheriff's department who really get to us very quickly if we need their help, but not at all. We're all trained professionals. As Deb said earlier, we have medical doctors and nurses, licensed social workers, addiction treatment professionals, and we all work as a team to ensure our own safety and the safety of the person who needs to get help.
Sometimes it's just a conversation. Someone walks in the door and they just want someone to talk to.
Yeah.
They've been sitting out in the car, they just lost a spouse, they just lost their apartment, they lost a pet. Sometimes they just need to sit with someone for a half hour. It's a crisis to them, and sitting to talk to someone can alleviate or eliminate stressors for them, and then we do an intake, and sometimes it's just a human touch, to meet and greet somebody, and we sort of strategize, see who's the best one to deal with it when they come in sometimes, and sometimes they come back, and sometimes they just needed that, and we refer them to other services that they may need.
Does the team go through scenarios periodically?
Training?
Training?
Yes, we do. We have crisis training every year. We have training on how to deal with child abuse, domestic violence, substance abuse, mental health. We have a great deal of training at the agency and through our state agencies and in the community. All staff at all levels.
Yes, we really strive to stay at the forefront of our game, clinically and in providing services. When the program itself was introduced to the state, Putnam County really wanted to be one of the first.
Yes.
We weren't the first, but we were right up there as being one of the.
Do you folks intermingle, discuss with your neighbors in different counties in Westchester and Dutchess, Rockland, Orange, to come up with these plans, proposals, ideas to cope? To help these people cope?
There are statewide coalitions in all of our disciplines, Eric. For example, I belong to the Mid-Hudson Alcohol and Substance Abuse Providers Coalition, so all prevention and treatment providers can meet at in Orange County, and we can discuss issues, problems. The Office of Mental Health and the Office of Alcohol and Substance Abuse Services just had a public hearing on their 5-year plan in New York City that one of the other service providers and I attended, and I know Jason and Deborah and also Allison, who was on the show previously, we're members of different statewide agencies and advisory groups. So there's a lot of collaboration at all levels within the field.
We're also involved, the PROS team is involved in a lot of learning collaboratives, so they're in touch with other counties who do have PROS and really make an effort to learn from one another the best way to provide services to our folks. I sit on the care coordination board for the state, and we really try to stay ahead of all the regulation changes that are coming. We host annual conferences for all case managers statewide. So yes, we try to stay active, not just in Putnam. Yes.
At the cutting edge.
We're in contact with OMH all the time too. We end up going to a lot of their trainings, and the beauty of being in the field and being over 20, and you're able to really access people in other agencies and pick up the phone if you see a trend or you see something happening or you want to get their input or even work with them on something. We're able to do that 1, 2, 3. So we have a lot of supports in place for us.
So the bottom line is that if someone needs help, never be afraid to either pick up the phone, reach out for help, visit Putnam Family Community Services.
Correct.
Yes, and if folks are shy and want to think about it, they can peruse our website, look at the different services. We have lists of the groups that are available. You know, and my advice to most folks would be listen to your family, listen to your friends, ask around, and when you're ready, we'll be there. Okay.
Putnam Family Community Services will be there. We'd like to thank you for joining us for this edition of Spotlight on Putnam Family and Community Services. For Doreen, Jason, and Deborah, I'm Eric Gross. Thanks so much for joining us. We'll see you all next time. Bye-bye now.